I am going to talk about diabetes today, and I'm going to talk about diabetes not just because it has been an interest of mine for most of my professional life, both clinically and from a research perspective. And I really don't think I need to justify it in terms of the importance of diabetes in New Zealand and worldwide. Robert spoke about some of the success that New Zealand has had in terms of reducing rates of coronary heart disease. I'm afraid he quite rightly did not mention diabetes in the same vein because we have a terrible record in diabetes. The rest of the world does too, but things are pretty horrific. And I think you all know this, but I did think I would just mention and show you the extent to which the situation has deteriorated over a ridiculously short time frame in New Zealand. This is from the register of people with diagnosed diabetes in New Zealand. And you can see over a 10-year period what has happened in different ethnicities in the country. And also worth just noting, although I think it's fairly obvious, obviously there's age on the x-axis there, but it starts to take off at about the age of about 30, 35, reaches a peak in the European population in the late 70s, early 80s, but it's 10 years earlier in Māori, and it's nearly 10 years earlier again in Pacific people and people of Indian ethnicity. So we have got a horrible problem, and we are still nowhere near winning. Now, this is primarily about dietary fibre and carbohydrates. You've already seen the picture of Hugh Trial in Uganda. But I must just acknowledge Hugh Trial because in terms of fibre, I think, and diabetes, it really is Hugh Trial who drew attention to the importance of dietary fibre. I'm not really going to go into the history of this at all, other than just to make the point that John has already made. It was the observations in Uganda. But just a little story against myself. When Hugh came back to England, he wrote a number of things. And one of the things he wrote was this paper, which appeared in the Lancet in 1974, which showed that death rates from diabetes reduced during the Second World War, during the period when many things were not available, but national flour was introduced instead of the typical refined flour which was introduced, and it continued until the mid-1950s. And of course, national flour was relatively unrefined and very high in dietary fibre. And he wrote this paper relating dietary fibre increase to the reduction and once again the increase in diabetes mortality. I was working with Richard Dole in Oxford at the time, and it was sort of, I'd abandoned clinical medicine for a short period of time and decided I needed to learn some more epidemiology. And Richard Dole was sent this paper to review, and he said, "You were interested in diabetes, and it's a bit clinical sort of stuff." I didn't know Hugh Trial at that stage. I did, and I didn't know what Hugh Trial had done at that stage. So I reviewed this paper for the Lancet, and I wrote and said it was the biggest load of rubbish I'd ever seen in my entire life, and strongly recommended it be rejected. The Lancet didn't take my advice and published the paper. And this, for a long time, remained one of the sort of backbones of evidence. And of course, I was absolutely correct in criticizing it from an epidemiological point of view, but nevertheless, it was an interesting beginning to the fibre story. Now, John has mentioned that fibre, particularly in Germany and Britain, was known about for a long time. And in fact, it was even known by people who should have known a lot about diabetes, in fact, who did know a lot about diabetes. And in fact, Lawrence, who was one of the authors of the paper you mentioned, John, he had diabetes himself and was actually one of the first people in Britain to have insulin. A fascinating story in its own right, but I won't go into that now. But really, the diet for people with diabetes has almost exclusively been a low-carbohydrate diet that was recommended from the beginning of time. And this is a man called Thomas Willis, who was mainly known for his work in neurology, the Circle of Willis. But in fact, he was one of the people, and that allegedly is holding up something which he tested for sugar somehow, but, described diabetes, but he also recommended the treatment for diabetes, and it was basically just don't eat any carbohydrate, and the diet which he recommended was absolutely appalling, going back to the 17th century. But throughout time, this is in Germany, despite the fact that there was work going on in Germany about the potential benefits for high-fiber diets. This man called Schnee, who wrote a critical book on the management of diabetes, including the dietary management of diabetes, he incidentally also clearly described in the 1880s type 1 and type 2 diabetes. He didn't call them that. He called them brain diabetes was type 1 because it was sort of lean, clever people that got brain diabetes. And then he talked about type 2 diabetes in a very derogatory way because they were people that ate badly. And so the descriptions are all there. And in fact, he even described what we now know as the metabolic syndrome, got no recognition for it subsequently. He went into diet in some detail. But again, it was easily digested animal and vegetable food and absolutely no starch and sugar. And really one of the major British textbooks of medicine around the end of the 19th century, Osler, who was from originally in North America and then in Oxford as Regius Professor of Medicine, he described a very interesting dietary and lifestyle advice, but again, no fruit and garden stuff, and again, no carbohydrate. Turkish bath, flannel next to the skin. I'm not quite sure how much that was worth, but he did recommend very strongly an equable climate. So he sent all his private patients off to Italy and France, where I think many of them died because there was no insulin. Don't think it had anything to do with their diet. High carbohydrate diets have been recommended in the literature, and had John not been talking about historical aspects, I would have been interested to talk more about high carbohydrate diets, starting, as you can see there, from the 1st century with Areteus of Cappadocia, recommending a high carbohydrate diet for people that had the symptoms of diabetes. And I'm not going to go into this, save to mention Himsworth. The reason I put references there is obviously the potato diet and the oatmeal cure didn't have many publications in recognized scientific journals. But Himsworth published really very interesting stuff in the 1930s, pointing out that carbohydrate tolerance was and insulin sensitivity was improved on high carbohydrate diets. But of course, they didn't in any way mention dietary fiber, although when you look at the diets that Himsworth actually used, they were high fiber diets, as we now know them. Interesting, actually one of the early people in sort of the post-1950s era, Stone and Connor, recommended high carbohydrate diets for diabetes, but that was mainly in terms of reducing fat and cholesterol, because they drew attention, as did one or two other researchers at the time, the enormously high rates of coronary heart disease in diabetes. So that's really the end of my sort of brief historical overview, and I'm going to now get on and talk about the time that dietary fiber started appearing in the nutrition and diabetes literature as a means of seriously treating diabetes. It was extraordinary. Somebody did a search, not me, of the major diabetes journals up to 1975, just before this paper was published in the American Journal of Clinical Nutrition, and there was almost no mention of dietary fiber in any of the specialist diabetes journals. So this was really the #1 paper, and this was published, as you can see, in the American Journal of Clinical Nutrition, and it was an uncontrolled study of 13 people, 13 men, who were put onto a very high carbohydrate diet, and they actually here mentioned dietary fiber. Anderson, who was really the senior author, I think, of this paper, was seriously interested in the work that had emerged, really resulting from Hugh Trial's descriptions that we've been talking about. And what he showed was he took these people who were on sort of medium to low carbohydrate intakes at the time, 40% calories from carbohydrate, and then gave them this very high carbohydrate, high fiber diet. And unsurprisingly, especially those who had not had large amounts of insulin in their treatment, they showed remarkable reductions in their diabetes pills that they were taking, and some of them actually came off insulin. And this paper aroused an enormous amount of interest at the time, to the extent that a number of people, in Britain at any rate, were sort of immediately taken off insulin and put onto a high carbohydrate diet. What these people who tried this wonderful experiment didn't realize is that in Britain, at that stage, very few people with type 2 diabetes were treated with insulin. So in Britain, if you were on insulin, you had type 1 diabetes, and there were people admitted to hospital in ketoacidosis. So it didn't really prove to be a very clever treatment, stopping insulin. But that was the pivotal paper at the time. The first controlled study was a very small study, actually published as a letter to the Lancet, was from David Jenkins, who looked at guar gum and obviously an extracted fiber, soluble fiber extracted, and showed that actually if you fed this guar gum to people with, there was type 2 diabetes now, you reduced urinary glucose. And that was quite interesting, but guar gum wasn't the sort of thing that people were eating at the time. So there was interest in this, but obviously limited in what one might do about these findings. We had actually started some studies just before the paper by Anderson was published, largely because I'd heard Anderson talk in the United States about some of his work. And of course, with my experience of having rejected Hugh Trowell's paper, I had started to take an interest in dietary fiber and diabetes in the mid-1970s. So we started with a number of people that came to work with me. Richard Simpson was the first of these, an Australian from Melbourne. And we looked at high carbohydrate, high fiber diets in a controlled study, both in type 1 and type 2 people with diabetes, comparing the high fiber, high carbohydrate diet with a typical low carbohydrate diet of the day. So 40% carbohydrate was absolutely standard. Stuart did a big survey in the United Kingdom with one of his colleagues at Queen Elizabeth College in London, and that was the sort of diet that was recommended, very low in free sugars, to get the carbohydrate down to 40%. There was no real interest in dietary fiber at the time. Moderately high in fat, as you can see. And the sort of diet that we used was the sort of diet that we still recommend, but not particularly one high in soluble fiber from sources, and I'll come on to that in a moment, but largely derived from cereal-containing foods and vegetables, the sort of products that now are described as whole grain products, but that too was very low in sugar. And these papers were published both for type 1 and type 2 diabetes in the British Medical Journal at the time, and as you can see, this is a 24-hour blood glucose profile, but there were modest reductions in hemoglobin A1C at the time, but you can see for virtually the whole day on the high carbohydrate diet, blood glucose levels were improved, and this was translated into an overall improvement in glycemic control. The studies continued for about 6 weeks. Each of the experimental diets continued for 6 weeks, and in parallel with this, we saw a reduction in total and LDL cholesterol. I think I've shown you the figures for type 2 diabetes, virtually identical in type 1 diabetes. But by the time we'd finished these studies, David Jenkins had already discovered that there was more to fiber than guar, gum, and he suggested that what was described as soluble fiber at the time, and there are major problems with defining fiber as soluble and insoluble, given problems of measurement. But fiber that came from these leguminous sources might be particularly useful. And again, David's studies were sort of relatively acute, short-term duration. And we started some studies in the late 1970s, published, as you can see, that was the first issue of The Lancet in 1981, of the effect of not so much concentrating on cereal fiber, although the experimental diets included cereal fiber, but they also included a substantial amount of fiber from these leguminous sources. And you can see here, I just want to really draw your attention to the hemoglobin A1C, bottom line of the slide, a 1% reduction in hemoglobin A1C in these very carefully controlled studies, high carbohydrate, high fiber. We were very careful not to let these people lose weight, so they were energy controlled. So this was purely an effect of increasing the carbohydrate and the fiber. So these hemoglobin A1C was still presented then in percentage terms of total hemoglobin, remarkable reductions, particularly in view of the fact that in many of the participants, we had to reduce their intake of either their insulin or their oral agents that they were having. Equally, there were reductions in the lipids, which I haven't shown, no increase in triglycerides, which is relevant in terms of current concerns, and also no increase in insulin levels, another concern which I'll come back to. And this is just showing the comparable improvement to what I showed previously for the cereal fibers, reduction in total and LDL cholesterol. Now, the big question that we looked at then was, we had looked at high carbohydrate, high fiber diets. Benefits had been suggested of high carbohydrate diets previously. So the question that arose was this something about carbohydrate, or was this something to do specifically with dietary fiber? So we started with another Simpson. I had 3 people called Simpson working with me. 2 of them published quite a lot, the other one didn't. But this was Hugh Simpson, not Richard Simpson, and Hugh Simpson did another series of studies looking at high carbohydrate diets that were not high in dietary fiber. The high carbohydrate diets were not high in sugar. They were mainly high in complex carbohydrate, polysaccharides, but not high in dietary fiber. What you can see is that the glucose levels this time, the high carbohydrate diet without fiber, were associated with marginally worse blood glucose levels during the 24-hour profiles. The insulin levels were appreciably higher, and the triglyceride levels, which I haven't got a slide of, were also increased on these high carbohydrate diets, moderately increased. And interestingly, there were no changes in total and LDL cholesterol, but on the high carbohydrate, HDL levels actually fell. They had shown no change on the high fiber diets. So we were pretty confident that dietary fiber, if people wished as a component of high carbohydrate diets, was a pretty good thing in the nutritional management of diabetes. And I stress again that all the studies that we did were quite independent of weight reduction. So as we accept without any question of doubt the importance of weight reduction has been shown repeatedly recently as being important, we've got a pretty good thing going here for the treatment of both type 1 and type 2 diabetes. And things became very popular. We knocked up a diet book in a weekend with the dietitians in Oxford. Never have I done anything which has been quite so successful. We literally did this in a weekend, and the book was translated into I don't know how many languages. That's just 3 of them. And we were just absolutely overwhelmed by this interest, turned into a bestseller. And the Americans had totally rejected all this. They thought this was untrue until they actually proved themselves in a paper that was published in the New England Journal of Medicine in 2000 that actually what had been done in Europe was right. And I did have, but Leslie told me I had to take out a whole lot of slides because my talk was too long. But I did have a lot of slides which showed that, in fact, it wasn't only our group in Oxford that was doing these studies. A number of colleagues throughout Europe had done virtually, well, not identical studies, but have certainly come up with virtually identical results. But once the Americans showed it for themselves, then it was all okay. Just a word, and I'm not going to talk about extracted and synthetic fibers, but there's been a lot of work on extracted and synthetic fibers, first of all by David Jenkins and his group, but by many other groups as well. And there is no doubt that as far as blood glucose is concerned, some of these fibers do play a very considerable role in reducing blood glucose levels. Just what their place is in clinical practice is, of course, another matter, which I'm not going to go into now. So I really thought we had this sussed. We could move on to do all sorts of other exciting things. We'd sorted out diabetes and fiber. And, of course, that was a stupid conclusion to reach because, of course, we hadn't. And then what happened in just before 2015, sort of about 2012, I think 2010, 2012, people started to say, actually, no, low carbohydrates is what you really need to have for the management of diabetes. And I'm really just showing a couple of slides from this paper because this paper published by Feynman and colleagues in Nutrition in 2015 said there was really 12 points of evidence which supported low carbohydrate diets in diabetes. And this very interesting article, which I'm just going to show you a few slides from, was very interesting where the funding sources came from, the Atkins Foundation, Global Dairy Platform, McDonald's, Jenny Craig, and the Low Carb Meal Replacement Company. So, perhaps I'm being unreasonable, but, when one does see that sort of support, you do sort of have a few questions. And this was the evidence. This was the evidence. First of all, there's no doubt that if you just take an ordinary old low-calorie diet and you compare it with a very low-carbohydrate diet over a relatively short period of time, and it seems that the magical time is something like 6 months, there is no doubt that the very low-carbohydrate diet, very often ketogenic, does produce impressive reductions in hemoglobin A1C. So that was one prong of evidence. The other prong of evidence, which really annoyed me because it's the grounds from which I criticized poor old Hugh Trowell's work and suggested the Lancet didn't publish it, but it was the suggestion that diabetes rates were going up in the United States in parallel with an increase in carbohydrate. And here we come back to something that's been raised a couple of times, this terribly awful, horrible misconception that carbohydrates are a package and that you should just think about carbohydrates as carbohydrates. And yes, it seems that carbohydrates were going up, people were getting more diabetes, but it is a total disregard of the nature of the carbohydrate. And so Feynman went on, if you looked at low-carbohydrate diets versus healthy eating, low-carbohydrate diets were better at weight loss. They produced more weight loss. But again, no distinction between type of carbohydrate and no distinction in terms of duration. And then looking at very low-carbohydrate diets versus low GI diets. And again, the very low-carbohydrate diets, as you can see, the red triangles being better than the low GI diets. And this is just another similar comparison, again showing in red the tremendous benefits in terms of weight, hemoglobin, A1C, glucose, total cholesterol, and most especially triglyceride from the effect of very low carbohydrate diets, but again, no distinction with regard to type of carbohydrates. So in the last couple of minutes that I've got, really just to bring you up to date with some data, studies in which I've been involved, but again, there are other studies which show something similar. With some of my colleagues in Norway, they involved me in a systematic review and meta-analysis looking at dietary quantity in the dietary management of type 2 diabetes. So this is a meta-analysis, and you can see, I think, very clearly, this is body weight. that if you look at the overall effect, it looks as if there may be a little bit of benefit in terms of low carbohydrate diet. But in fact, the benefit of low carbohydrate diets in the meta-analysis entirely is apparent when the studies were 3 to 6 months duration. And this is what Feynman and many others completely overlooked, was this question of duration of study. When you looked at studies that were 12 months or more, there weren't all that many studies in the 6 to 12 month period. 12 months or more, there was absolutely no benefit in terms of weight loss, and an absolutely identical result in terms of hemoglobin A1C. There was short-term benefit in reduction of hemoglobin A1C, but no long-term benefit. So this is just another study which has been published since that meta-analysis, which shows the same results very convincingly. Andrew Reynolds has been looking at a meta-analysis of comparing higher and lower fiber intakes in the large number of clinical trials that have been done, but only clinical trials where the carbohydrate intake was balanced. So not like some of the early ones which we did, but identical carbohydrate intakes, high versus low carbohydrate. And again, you can see that when considered overall, there has been, in this updated meta-analysis, a benefit of dietary fiber. And 2 points which he's made there. One is that the effect size was greater in trials that did not control weight, and was also greatest in countries where the baseline fiber intake was low, findings that were not surprising. And then I think something that is enormously interesting, which hasn't got anything like as much attention as has been deserved. Here are the results, the cohort study results, where people with type 2 diabetes largely were included as part of the EPIC study, which many of you will know about, which was not specifically concerned with people with diabetes, but because it was such an enormous study, they were able to look separately at people with diabetes, and you can see very clearly here the benefits of people in terms of all-cause mortality of high intakes of dietary fiber. So really quite a remarkable effect, a 20% overall reduction. If you included also the Eurodiab people who had type 1 diabetes. So the benefits of dietary fiber in this very substantial cohort, not of course as big as the cohorts that Andrew mentioned for the population at large, but nevertheless very big clinical follow-ups. So pretty much a 20% reduction in total mortality of high intakes of dietary fiber. That is just another study, again, a meta-analysis really showing no benefits overall of low carbohydrate diets in the population as a whole. I have exceeded my time by several minutes, but simply to conclude, really in terms of carbohydrate, it is really quality that matters rather than quantity. Probably a wide range of carbohydrates is acceptable for people with diabetes. They just need to make sure they have the right kind of carbohydrates. There is absolutely no long-term evidence of benefit of low or very low carbohydrate intakes or ketogenic diets in type 2 diabetes that I've seen. That doesn't mean that some people haven't done well on them. Some people do seem to have done very well on them in the long term, but in terms of formal study, there is no evidence of overall benefit of these diets compared with the kind of diets I'm talking about. And of course, the really important thing for diabetes is the fact that dietary fiber confers appreciable benefit beyond simply improved blood glucose control, because what many people with diabetes suffer from and die from prematurely is cardiovascular disease, and it does seem that dietary fiber has an incredibly important role here too. So I think I've forgotten what I called this presentation, something about villain or friend or foe or something like that. Carbohydrate. I think carbohydrate is a reasonable friend, provided you get to know it in terms of the nature of the carbohydrate. If you don't get to know carbohydrate, it could indeed be a villain. The end.